Oh my God, is it working? It's working. Okay, yay. I've started this presentation like 5 times because I did it in the most difficult way possible for no reason, but here we go. It's working. Oh, wrong button. Okay. Hello. Welcome to my topic of interest presentation. My name is Maya, and I decided to do this presentation on doctor-adolescent dyad communication. So I wanted to look at how social stigma creates how or if social stigma creates communication barriers between adolescents and medical professionals. So the who of my research would be college students who have visited the student health center in the past and medical professionals at the student health center because those two populations email wise are available to me. So both of these populations, because we're dealing with medical information, could be possibly protected populations. However, the surveys that I would send out would be completely voluntary and it would have like not a lot to do with specifics of particular medical conditions. So as long as nobody yells at me after this presentation, I'm going to assume that those HIPAA laws don't super apply to this situation. I really want to study what role social stigma plays in communication between adolescents and medical professionals, and like how that affects the medical care given. Um, I would like to ask doctors and college students. I would like to ask college students: have you lied to a medical professional in the past about things that could create friction in the communication between you and your doctor? And I want to ask medical professionals how often they perceive deception in communication with their patients. And if they perceive that perception, if they know it's happening but they can't detect it, like what kinds of things affect that interaction. And then I also, the way that I got this idea for this project is listening to narratives that my friends have told me about going to the student health center and experiencing negative medical interactions with doctors due to social stigmas. And I think that it would be a really interesting angle to also research how gender or other minority identities play a role in this, because just based on the narratives that I've heard, that's been a big factor. And so I would like to also look at that and then possibly look at what role um, that particular deception and or not deception plays in the medical care given. So I think that the reason I want to do this research is because I want to work to prevent the social stigma from occurring in the first place, because I think that if we can identify it, then there's a better chance that it can be prevented. Cool. And so this is a communication topic because, as we learned in week 2, communication is just the relational process of creating and interpreting messages that elicit a response. Maybe not just that, but as a basic definition. So the patient in this situation, this is a prime example of relational processes, because the whole interaction itself is communication in a high stakes way. So the patient will create messages by describing symptoms, and then which is message creation, and then the doctor interprets messages to determine what the symptoms mean, so that's message interpretation, and then a response is given in the form of a diagnosis. And then the process will continue depending on what medical care is needed. So all of this is exactly communication, and the results of it are high stakes. And then why is this topic important to research? It's important to research because it's a direct example of how social pressures have the power to shape our physical lives. So if my research does result in a causational connection between deception and poor medical care, then that would be a really interesting look into how social stigma affects us, and our health. Um, I feel like we always talk about social stigma and how it affects mental health and how it affects like human agency, but this is like a physical human agency example. So I think it could be interesting. It could also shed light on a potentially dangerous phenomenon that's occurring on college campuses. And it could spark further conversation about how to de-integrate biases from medical practice. And then the theories that I thought buttressed this research, I like kind of thought there were three that we've talked about that could possibly help and cultivate the process. So the first one I thought was privacy management theory, because obviously the communication that's going on is the foundation of which is very private information. And so the information that is disclosed is private, and the way that the doctor handles that information either creates a shareholder relationship with that information, or it creates boundary turbulence. And so looking at those flip sides of the coin is really what this project would be about. The other one that I thought was co-cultural theory. I would really like to take that angle with the minority identities and how they approach medical conversations, as opposed to, maybe not as opposed to, but I would just like to look at that angle. So if I did do that, how do patients of minority identities talk to doctors of dominant ones? And that would obviously be a co-cultural theory, in the co-cultural theory realm. And then the last one I thought could apply to this was sense making. How do doctors apply logical like sense making to their work? Doctors are very educated people, obviously, but they do have to have some sort of like personal foundation for their work in order to come up with diagnosis that they have. Like sometimes they have to do research on the spot. And so how does that foundation for their practice influence their communication interactions? So yeah, I think and then lastly, the questions that I had for the development of this project are: which proposed theory out of those three do you think I should give the most attention to? I know there are three of them. I could kind of I could focus on all three. Like I could really take elements from all three of them, but which one do you think applies most? And then are there important aspects of this topic that I'm missing? Like, does anyone have any suggestions for questions that I should be asking just so that I don't miss anything? Or that would be interesting for this? And then lastly, should I include research from the perspective of medical professionals, or do you think that would be too much? My thought was that I would compare the survey data against both of those demographic populations. But if that doesn't make sense for this research, yell at me, let me know. Anyway, thank you.